Hi, I'm Michael Reeves. I'm a physician. I work in long-term care and nursing rehab, and been doing this for about 33 years. I actually am the senior guy in our group. Our group takes care of about 45 long-term care and rehab facilities, along with about 15 assisted livings, and we practice in about 3 states. We've been around for quite a few years and have about 150 years of experience taking care of this particular population. We actually are the largest group like this, and certainly the premier group in our area of expertise. So what I wanted to actually discuss with you is a problem that we recognize, and many others are now beginning to recognize across the nation. And the problem is the care of this subset population that goes home from the nursing rehab, and they're within a window of 2 to 3 to 4 weeks before they get back to their primary care physician, if they have one. And there's some things that happen during this time that are very concerning to us and many of our colleagues, and certainly to the patient population that we've discussed this problem with. And that is the emotional and physical fatigue that individuals, caretakers, wives, husbands, of spouses who have gone through a post-hospitalization nursing rehab process, whereby they go home and they're having to take care, they're the caregiver for their spouse. This is so many times very physically and emotionally fatiguing to the individual who's taking care of their loved one. Oftentimes this duty falls to the spouse, but many times it falls to the children of these couples. We wind up where the patient is having to be taken to a doctor's office, a doctor's appointment, if not multiple doctor's appointments. And the child sometimes has to take off from work to escort mom and dad to the office. Once at the office or at the lobby of the office building, we find that if the patient has confusion or difficulties physically, many times the spouse that's the caregiver has to drop them off at the lobby of the office building and then go and try to find a parking space and navigate her way back to the lobby where she's left her loved one or spouse or whomever in charge to someone that she may or may not know, and then navigate her way up to the doctor's office. In the doctor's office, again, you have another encounter that's very emotionally and physically fatiguing, waiting for a couple of hours for the doctor to come in. He may be far behind. He may have had an emergency, and you're trying to control the confusion in your loved one that's wandering around the doctor's office, and it becomes a very full-time, 100% diligence that you've got to have in overseeing that spouse. Once you've gotten into the office and then seen the doctor and you leave, oftentimes you're carrying a prescription with you, you're carrying a lab request, and the doctor has instructed you to go to have an x-ray done at certain diagnostic center, and maybe then go to a lab and have some laboratory blood work drawn, and then from there you may be even having to go to the drugstore and get a new prescription filled, or all of these are encounters that, again, are very emotionally and physically fatiguing. It may be that you left at 7:30 that morning and you may not be getting home till 5:30. And even for the youngest of folks, sometimes that's very tiring and wearing. So there's all of these factors to consider. In addition, the safety of your loved one who's being moved around from facility to facility. The weather sometimes is a big factor. exposing the exposure of your loved one to inclement weather is sometimes problematic, and so you've got a great deal of, again, physical and emotional expense as well as actual expense, because sometimes someone has to take off work, they lose money. Sometimes people may have to hire a driver to drive them around. These are all part of the problem that we've recognized that is our group is able to address many of these problems. There's actually another part of this is the problem is medications that we're trying to ensure are being taken appropriately. And I know when you go home from the doctor's office or from a facility you've been residing in and receiving rehabilitation in, you get home and you may find that you've got 2 or 3 sets of medications. The medications you were sent home with from the facility, the medications that you were sent over to the facility with from the hospital, and you may get home and open your medicine cabinet and then there's an additional set of medications that's been there and you're not sure if you're supposed to be taking those. So these are problems that are very anguishing and confusing for most of us. So our job is to try and eliminate some of these problems. So really the question becomes, why has this problem not been solved? And we've identified a number of factors that explain why it hasn't been solved. For example, one is the large mass and volume of records and charts that are required in an office at bricks and mortar, where you have to go and see your doctor. It's massive sometimes. With our new approach with EMR, electronic medical records, we've been able to eliminate this. So this is one aspect of why hasn't been solved. The other aspect is, doctors are in office buildings. We're very, very busy trying to see 40 to 50 patients a day to keep up, and no one's had time really to go out and take this approach to medical care delivery systems. Additionally, one of the things is you go to the doctor's office, and I mentioned before, you may have to go to a lab or x-ray facility to get these other portions done. So the testing that we've had to undergo with these different requirements is basically, now today it's more portable. You can actually become a virtual office, whereas before it's been having to go to this entity, to that entity, to the drugstore, and what have you. All of that's available to come to you now, rather than having to load up and go to them. And this is basically because now we've adjusted. Insurance companies have been discovering that maybe this is a better way to do things, where we don't have all this unnecessary fatiguing and emotional component involved in getting care delivered to us or our loved ones. Really what I'm talking about is somewhat of a new service. And let me explain that, because it's not a new service in a way. I'll give you an example, a little story. I had an attending physician one time who was my preceptor, and he, back in the 40s and 50s, he made house calls. He told me he quit making house calls because he had one time been called to a patient's home. He went to see the patient. It was raining, and back then they didn't have really good roads. He wound up seeing the patient, $4 office visit or $4 home visit, and he got stuck on the way out. The wrecker fee was $35, getting him from being stuck in the mud. So the service has existed, but we're really coming back to it. Some of the physician academies are now talking about medicine coming back home, and this really is the case. So how is that happening? How can you go from medical care that's delivered in a bricks and mortar setting in multiple facilities to a concept of new service coming back to the home? Well, it happens because now we've got a new way of doing things. We have electronic medical records, so you don't have to have the bulky files to haul around. You haul it on a small little iPad or a little laptop. Additionally, we have pocket diagnostics now. One company, General Electric, has a new device where it fits in your pocket. You can actually do an ultrasound on different parts of the body. We have the ability for portable x-ray companies to come to your home, do an x-ray, and within 4 seconds of shooting that x-ray picture, it can be on our iPad or our iPhone or our laptop. That's availability. So, and additionally, even medications. If you need a drugstore prescription, many of the pharmacies now have set up home delivery programs so that once we see you in your home, we can, if we write a new prescription or a new dosage of a prescription, that pharmacy can actually have that patient to you the same day that we're there many times. So you've got a virtual office now that is in existence where we take the medical care and the medical diagnostic tools with us to your home. Lab work, blood work can be drawn at your home. One company that we use can draw the lab work. We can have the blood work reported back, the results reported back to us the same day. These are ways that we can make quick decisions about your needs and directing your care. So let me try and sum up what we've been talking about. You know, instead of your mom or you or your dad having to take off work, take mom or dad to the doctor's office, to the laboratory, to the x-ray machine, to the pharmacy, instead of your loved one having to go out in inclement weather, instead of you're having to take off from work and lose time or money, instead of all of this, instead of having to try and reconcile 3 different sets of medications you may find yourself with at home, instead of all of this, you pick up the phone, you give us a call, and we come and take care of your loved one. And let me say this, you know, this is all we do. We do not take care of other populations. We do not have a doctor's office. We do focus on this particular aspect of healthcare. This is where our heart is. This is where we've dedicated our careers to, and we would love to be involved with the care of your loved one. All you have to do is pick up the phone, give us a call. You don't have to take mom or dad out of the comfort of that warmth of the home in the bed they're in, and call us. We'll arrange a schedule. We'll get someone out to see you and try to meet these needs. Obviously, we can't do certain things. We can't carry a pocket MRI around. We can't carry a pocket CT scanner around. But we do have the availability to have almost completely a virtual office available to you to reduce all of these unnecessary discomforts and troubles surrounding your loading up and going to the doctor's office or the laboratory. So just pick up the phone, give us a call, or you can email us, and we'll be glad to talk with you further about what's available in this process.